Good morning, everyone. My name is Dr. Rathna Devi. I'm a Senior Consultant Radiation Oncology, Apollo Cancer Institute, Chennai. We are in the month of October. What's so special about October? October is known for Breast Cancer Awareness Month, the pink ribbon. Why so much of importance only to the breast cancer when the cancer can affect any part of the body? Yes, we are having an importance, especially with the breast cancer awareness, is for a reason. The breast cancer has been increasing when you compare to the last year, the previous year. Every year there has been an increase in the incidence of the breast cancer patients. Every second breast cancer woman is dying because of this disease. So it is mandatory that all of us are aware of this dreadful disease, breast cancer. As you know, cancer is the second most common killer in our country. The first being the cardiovascular, second being the cancer. Among the cancer, the head and neck cancer, that is smoking related cancer, is of very high incidence. When compared to the female population, apart from the head and neck cancers, what else is being more common is the breast cancer. As compared to the cervix cancer, breast cancer is increasing. Last year, what is the statistics and what is the statistics now? It is showing a jump. Every person, like 8 in 1, is having the risk of developing breast cancer in one's lifetime. So, breast cancer is very, very important and we have to be aware of this disease. Cancer, what is cancer? Is it an infection? Is it something like corona? No. It is an abnormal proliferation of our own cell which metastasize from one part of the body to the other part of the body. Like for example, if the cancer originates from the breast, it doesn't stay only within the breast, it starts moving from one part of the body to the other. That is from breast, it can move to lung, it can move to liver, it can go to bone, it can go to brain. So, that is why it becomes very important we identify this cancer at a much earlier stage in order to save the person completely. Is it identifiable? Yes, 100% we can identify the cancer at a very, very early stage by means of simple screening technique like self-breast examination and mammogram. So, these two mode of screening is very, very important for all of us to know about it. Let me talk a few words on this self-breast examination. Self-breast examination is you examine your own breast every month in your privacy, in your bedroom or in your bathroom. You use the right hand to check on the left breast and left hand to check on your right breast. Always go in a circular motion to palpate your breast and don't forget the axilla. Stand in front of the mirror with both the hands raised to see whether the nipples are at the same level. Whether you are seeing any dimpling or puckering of the skin is also important to see. Gently squeeze the nipple and see whether there is any discharge. The same, once you finish on your left side, repeat the exercise on the right side. This will hardly take about 10 minutes, but you will be completely aware of your breast, and if there is small change in the breast, you yourself will be able to pick it up. So, this is called as a self-breast examination. There are enough and more pamphlets are available. You can Google it and see how this simple test can be done. Please do not do this self-breast examination during your menses or just before the menstrual cycle. People who have attained their menopause can have a fixed date and do every month. What about mammogram? Mammogram is a tool, it's an X-ray tool. It's a simple X-ray tool, very sensitive, 85% sensitive and specific tool. This is a kind of a, it is a low kV, high MA X-ray tool, which can identify the breast cancer lump less than 1 centimeter in size. So, it is pretty sensitive, and when you can identify the cancer at that stage, you can cure it completely. Not only you can cure, you can save the breast as well. So, these are the simple screening tools which is available, not very expensive, and the recommendation is for above the age of 40 years and yearly once mammogram is what is recommended. There are certain myths about the breast cancer. Let me go one by one. Young people don't get breast cancer. It's wrong. When I joined my medical school, it was taught, the first day, the teacher taught me, cancer is a disease of old age. But in reality, what I'm seeing in my practice, it is not the same. And there are enough statistics has proven that females at age of 40 and less than 40 are affected by this breast cancer. So younger women are no exemption to be escaping this disease. Small breast women don't get breast cancer. Is it true? No. The size of the breast does not matter. Any size can get this breast cancer. Does male get breast cancer? Yes, male also do get breast cancer, but that is less than 1%. Then talk about BRCA, BRCA1 and BRCA2, Angelina Jolie. She made this very popular. Yes, BRCA positive shows that there is a high risk for that person to get breast cancer, but it is not a screening tool at all. What else the myths are? I've gone to a college, in girls' college. There was a girl who asked me, does black bra, wearing a black brassiere, will it give breast cancer? No, there's nothing color related. If you wear a black bra, that doesn't increase your risk of your breast cancer. What is the risk for breast cancer? Nulliparous women, one who is not able to give birth to men, people who get married at a late age and the first childbirth is above the age of 31, and long period of using hormone replacement therapy, early menarche, late menopause, and there is a family history also. There are family history in a woman's life, like a family history of CA breast. There's about 10% risk that person can get breast cancer. These are the risk factors. People who are having risk factors, they should definitely go to their doctor and check it up. Above the age of 40, it is mandatory. There are many types of lump. How does the breast cancer present? It usually comes in the form of a lump. It can come as a discharge. It can be a bloody discharge in the nipple. The skin can show excoriation, like a redness of the skin can be seen. So there can be a dimpling of the skin, orange peel appearance of the skin. There may not be any symptoms at all in the breast, just the armpit will show a lymph node. So that also you have to pay attention. That is what I said, when you are doing a self-breast examination, please examine your breast as well as your armpit. So these are the common symptoms with which a breast cancer presents. But I would also like to tell you, not all lump you feel in the breast is not breast cancer. 80% of the time, these are normal benign tumors. But who's going to tell you whether that is a benign tumor or a cancer? It is we, the doctors, who are going to tell. So what you are going to do, if you're feeling a lump in your breast, please do not panic. That is number one. Please consult your doctor. Let us tell you whether there's something to be, we have to take steps to help you out, or there is nothing to worry. There can be simple cysts, there can be fibroadenoma. These are much more common. 80% of the lumps are these type only. The problem with the breast cancer, these lumps, when they are very small, they don't give any pain at all. So most of the women, because it doesn't cause any symptom, when they palpate the lump, because it's not giving them any problem, they generally think nothing to worry. So don't be like that. The whole awareness program is to tell you, if there is anything which is palpable, do not ignore. Same way, there is another patient, there's a case scenario I would like to tell you. There was a nice, good-looking lady in her late 40s. She came to me saying that her son by accidentally dashed against her breast and there was a swelling. And she thought it was trauma-induced because of the dashing or because of the whatever ball which was hit against her. So she ignored, thinking it was a trauma. But unfortunately, that was not just a trauma related one. She had a breast cancer underneath, and which came into the light after several days. So it had grown quite a big, and though we were able to save her life, the breast could not be saved in her life. So, but again, trauma does not cause breast cancer. Trauma, in this case, she thought because of the trauma, the breast cancer. It was only by chance, it was only a coincidence. Trauma does not cause breast cancer. So there are many incidences I can keep telling. There was a normal looking lady who came just for, like how we would like to go and check whether we are diabetic, what's my sugar level, what is my BP. Like that, she came for a cancer screening, and there was a small lump, less than 1 centimeter was identified, and we could completely save her, both the breast and the lady. So something what I would like to drive today as a cancer awareness program: do not ignore. You have to be aware of yourself. There are people who will tell, I didn't know there was a lump in my breast for so long until it grew up to this size. That is why you have to be aware of your organ. Self-breast examination is very important that you do every month, so that even if there is a small change, you yourself will be able to identify. People who come under the high risk group, do not ignore. Don't have this idea of, I am scared, I will not go and check myself. It is not a solution. The breast cancer incidence is rising. There can be many reasons. We can tell because of this, because of that, lifestyle. Yes, lifestyle also plays a role. Lifestyle, how? A poor diet and a sedentary lifestyle, and when the fat accumulation in the body is increasing, lack of exercise, all these also adds to the breast cancer. The statistics has clearly shown 30% of the breast cancer it reduces the incidence of the cancer breast incidence reduces with exercise. So exercise is mandatory. So all of us should have a very active lifestyle, good diet, less of fast food and more of antioxidants filled food. What is antioxidants? These are abundantly present in all colored fruits and vegetables. Vitamin A, vitamin E, vitamin C, co-lipoic acid, all this are good antioxidants which are present in natural form for us. So let's have those kind of good food in our diet. Once in a way, you indulging in the fast food is okay, but that should not be your lifestyle every day. So poor diet, lifestyle, exercise, all that helps in the good living. Apart from the exercise, again, habits like alcohol and smoking also increases the risk of breast cancer. So in short, what I want to tell, yes, the incidence of breast cancer is on the rise, but with good awareness. If you look into the US, there are only 1 death per every 6 cancer patients. Why? The awareness is very much there. They come to the doctor, there is yearly mammogram. So all these helps them to pick the cancer at a very early stage, thereby the results are very good. In our country, because lack of awareness, people are shy, no symptoms, so ignorance, all these are making this cancer very lately diagnosed. When you diagnose it lately, then the chances of a cure also comes down. So the main drive with this awareness program is to tell, be aware of your organ and always be cheerful, be happy, be stress-free. Stress is not good. So as young girls and the faculty, all of us should be happy, whatever may be, whether it is corona, whether it is cancer, breast, all of us should be happy. Let us exercise, let us have a healthy living. Thank you so much.